Joining us now to assess Obamacare's impact on all of us, Avik Roy, senior fellow at the Manhattan Institute, former health care policy advisor to the Romney campaign. Avik, great to have you here.
Thanks for having me.
I mean, they get four or five Pinocchios, pants on fire for lying, and then they get more for lying about the lies. At this point, this administration seems to have zero credibility. It's unclear whether or not solving the website will actually fix the problem. What is the real deal?
Well, there's a lot of points I can make related to the point about credibility. The credibility is not just damaged because of the failed promise that you could keep your plan, but the credibility in terms of the execution of a website. I mean, how hard can it really be to set up a website where you can shop for insurance plans? The private sector does it all the time.
Right. And very few people take note of that reality. But now we're looking at a model that seems to be under great distress as well. Not only a website that is not functioning, but we're looking at very few young people signing up for Obamacare, and they're the linchpin for the success of the Obamacare model. If they are not paying higher premiums in order to support older Americans running up higher expenses, this model doesn't work at all, does it?
You know, I don't know if you remember that famous scene in The Matrix where Keanu Reeves shows up and there are these tubes of millions of babies whose energy is being sucked out to feed the machines. And that's what Obamacare kind of is for young people. Yeah, the law depends on these young people to pay double or even triple in some cases the health insurance premiums that they would normally pay, so that sicker people and older people would pay less. And it's effectively a kind of involuntary tax because there's an insurance mandate, the health insurance mandate, that forces them to buy this coverage, but many of them may drop out anyway and still pay the fine.
Picking winners and losers, which is an absolute focus of this administration, capping expenses for older Americans at 3 times, while their normal expenses are 6 times those of younger people. There's just one element after another in this Obamacare system, model, plan, program, whatever you want to call it, that intelligent people would not design to have a positive result. Yet, here it is.
Well, at my Forbes blog, The Apothecary, we published a study this week from the Manhattan Institute that I participated in that showed that not only is it that the law requires insurers to charge young people a lot more for insurance so that older people would pay less, but the subsidies, the structure of the subsidies that help you pay for those premiums also disproportionately benefits the elderly. So the whole law is really an intergenerational transfer from the young to the near retired.
The redistribution built into this, to Obamacare, I mean, it's whirling in all sorts of directions. It is a vortex of forces from nearly every quarter. At the end of the day, does it work or does it not?
It works if young people sign up and pay for these $300 a month policies when they go to the doctor once a year. I think if you talk to most insurance pros, what they'll tell you is there's going to be modest adverse selection, which means that a lot of healthy people will drop out, a lot of young people will drop out. You'll get low-income people in because they're subsidized. You'll get elderly people and sick people in because they're subsidized. And it will be a much more expensive product that won't cover everyone.
And if we continue with this so far, a very clear, dramatic trend, more people signing up for Medicaid than for Obamacare, what happens?
Well, the Medicaid program is almost kind of a separate track, but that's going to do a lot to damage state budgets because the Medicaid program is very, very expensive and states have to pay a significant chunk of that.
We'll come back soon and we'll continue the discussion. Avik Roy, we thank you for being here.
My pleasure.